we shall ask the last speaker for this session, Laurent Petit, from LEEM, which is kind of French FPA. So the word is yours.
Okay, thank you. Good morning, everybody. Okay, so I have to speak about the expert involvement in patients in the French process. So I'm not speaking on the voice of the patient advocacy group, for instance, or obviously neither on the voice of a national expert. But I will speak about the perspective of a French company, for instance. And I'm sure Antonella will be quite happy because in France, patient advocacy group or patients are already involved in the market access process and especially HTA process. Previous HTA, European HTA, we already had in France a lot of involvement of patient advocacy group because the HAS, within the process of appraisal, has always asked for the voice of patients.
Always.
And what they ask, it's not the assessment or the appraisal of the drug. The expectation of the HAS is to collect the burden of the disease, the quality of life, and so on and so on. But patient advocacy groups and patients are really involved in France. And in addition, there is 2 members of the Transparency Commission. Yes. That are, but 2 with votes, who are involved in the process of the opinion of the Transparency Commission opinion. Yeah. Well, the question is, what is the impact of the consultation of the patient? The Transparency Commission, a few months ago, wanted to start a study to try to assess the impact of the contribution of the patient. But apparently, the study didn't start yet, and maybe it won't start. With the European process, the HAS keep on trying to involve patients. And for the PICO survey, for instance, we know that the HAS is trying to get information from patients, but it's quite difficult because there is not a lot of time to get this information. So I'm sure that the HAS is trying to do what she can, but it's not really easy. But at least it's really it's really the willing they have. So as I mentioned, in the PICO survey, it's possible request for input for national patients. And we know that the HAS is creating a pool of patients to try to be able to mobilize them. In the for the national patient advocacy groups, the HAS expect their input in the early access program process we have in France, but also for the appraisal process and the reimbursement process, and you can see what exactly the kind of information they ask for advocacy groups. The question is, what are the data available for the patients when they have to give their opinion? And as I mentioned, the expectation is the load of the disease, the quality of life, and so on. It's not the assessment of the drugs, but you can see, and I won't detail that, but you can see that with the joint clinical assessment report, the contribution of the patient advocacy group for the regular process of reimbursement will be easier because normally they will get the dossier submitted by the manufacturer at European level, and obviously joint clinical assessment report, meaning they will have all the data they need, everything, and it will be possible for them then to make a contribution for the appraisal with all the data available. Everything will be in English, but it's still possible to translate that. the role of expert, clinical expert. Well, there is quite strict rules in France on conflict of interest. So that's for sure. The HIS and the Transparency Commission try to mobilize experts, but with no conflict of interest. So it's quite difficult sometimes, but they do what they can. What can I say? Am I worried of what can happen in France with the HTA European system and the French system? Not really, because as it has been already said, well, you can understand that HAS, EQUIG try to make sure that they can still work as they used to, and they say there is no impact basically on the appraisal. So am I worried? Not really. Am I sad? Yes, a lot, because what we can expect from the European system is a compilation of 27 countries' expectation, but not a European really HTA process. So that's all I have to say.
Thank you very much.